We'll get started. Welcome everyone to our June 7th Mutual Learning Circle. We have a rich agenda today, so some of the content will be covered in our meeting today, and other content will be delivered to you by way of our meeting minutes following our time together. My name is Angela Fields, and I am the Associate Director of the Minnesota CHW Alliance, as well as the manager and facilitator of the Minnesota CHW Learning Circle. The mission of the Mutual Learning Circle is to provide monthly meetings that allow CHWs to connect, learn, and tap into one another's knowledge through discussion. The Mutual Learning Circle is brought to you by the Minnesota CHW Alliance, which lays out a platform design of clear organizational goals and objectives for the advancement of all those in the CHW profession. The Mutual Learning Circle vision is to create a workforce that encompasses the voices of those in the CHW profession. Our guiding vision and principle is to support our vision, nothing about us without us. Today, we will have our HRSA grant CHW scholarship informational session. We have in today both teams on the Minnesota Department of Health HRSA grant team, as well as the Mutual HRSA grant scholarship team. Today, we will do things kind of differently in order, considering time, and then we have a couple of projects that need to be promoted or brought to you because of the time-sensitive matter of these projects. So I will start with a bit of the announcements first, and then we'll get into the HRSA project presentation, and then we'll close out with questions and answers at the end. So just a moment. I need to do something else. Okay, let me just. And to talk a little bit about what I'm about to share with you today is the Minnesota CHW Alliance, along with the National Association of Community Health Workers, is working in collaboratively through a partnership to help explore and create a CHW virtual network. And so we are delighted to extend an invitation to you, our CHW members, to participate in a listening session where you can provide your input on an online platform for community health workers nationwide. This platform will be developed by the National Association of Community Health Workers, commonly called NASHWA, with the guidance from the Minnesota Community Health Worker Alliance and other CHW networks. We would appreciate your feedback on what we need, or what you need, want, and expect from this virtual platform. Your input would help us guide the tool that supports your work and connect you with other CHWs. The listening session will be about 90 minutes in length, and the session time and date is to be determined. We are looking towards the following dates to hold this session, and that's Tuesday, June 27th from 12 to 1 p.m. or Tuesday on June 27th from 4 to 5:30 p.m. Wednesday, June 28th from 12 to 1:30, or Wednesday, June 28th from 4 to 5:30. Also, our last date of interest is June 29th from 12 p.m. to 1:30, or Thursday, June 29th from 4 to 5:30 p.m. So we want to look at those 3 dates and those time preferences to see if we could recruit we need at least 20 community health workers to be involved in this project. At the listening session, we will share an overview of the project and ask questions to learn more about your thoughts, the thoughts and ideas of CHWs across the state of Minnesota. These inputs and perspectives are essential for developing a platform that would meet the needs of CHWs, not only in Minnesota, but across the nation. As a token and a gratitude for your time and participation, each participant will receive a $75 gift card for their participation, and that will be electronically sent to you. We are working out how we would like to set up a registration for this session. It will more likely be an Eventbrite registration process. So therefore we can capture everyone's, demographic information and be able to send out all of the follow-up information as well as the incentives for your participation. So we look forward from hearing from you and learning about your insight. And we hope to be able to select a date and get this project up and going. And so if anyone is interested, I will put my email address in the chat for anyone that is interested or have some CHWs that would possibly be interested in this listening session. So we will steer our conversation back to our topic of today, and that would be the Health Resources and Services Administrative Grant, also called the HRSA grant. And that is for a community health. It is a community health worker training program. MDH was awarded a grant in the fall of 2022. And in partnership with the Minnesota CHW Alliance, has been working to set up systems and processes to put all of these plans together to expand access to the CHW certificate program, create apprenticeships, and support for CHWs across Minnesota. Our presenters will be talking about the following during our time together. What is the HRSA grant and what does it mean? How to apply and all parties that are involved in this process, and what responsibilities of all parties involved, meaning MDH, the Alliance, students, and the schools. I will start with introductions of our teams and our team members. And we will start with the Minnesota Community Health Workers team. We have Rachel Stoll here with us today, and Rachel is a certified CHW who is continuing her role in Winona Community Hub as a Winona Community Hub manager in Winona, Minnesota, as she steps into her new role as the HRSA program manager at the Alliance. Rachel has experience in working in the field as a CHW at the Winona Community Hub prior to her current administrative roles. As a CHW, Rachel worked directly with participants of the Hub program to address social drivers of health, improve health literacy, and health outcome. Rachel brings a passion for equal access and equitable distribution of resources to her new role, and will work to ensure that the HRSA grants will benefit communities in every corner of the state. Rachel is excited to work collaboratively with such an amazing team and to be a part and to be able to engage with a wide variety of stakeholders in this work. Welcome, Rachel. Our next team member is Bonnie Howard. Bonnie is the Minnesota HRSA Field Experience Apprenticeship Coordinator and has been a CHW certificate holder since 2008. She has a rich background in healthcare and is known within the CHW profession for her work with older adults, as well as working with adults with mental health and chronic health diagnoses. Bonnie has contributed her CHW expertise within several projects led by Minnesota and Minnesota partners, including the Mississippi Department of Health CHW training. She's authored the revised Minnesota CHW curriculum, Healthy Lifestyle modules, and participated in the second cohort of the Minnesota CHW Leadership Development Institute. And Vayi is a doula. Welcome to the circle, Vayi. Just a minute.
I came just in time to say welcome, Vanya.
Welcome.
Latrice.
Yes, definitely so. Welcome, Latrice. I had to wet my whistle for a second. A lot of reading here. Next, we have on our Minnesota Department of Health team, MDH, we have Christian Guthrie Walters. is the Community Health Worker Training Program and Community Engagement Director in the Health Promotion and Chronic Disease Division of Minnesota Department of Health, where she has oversight of the HRSA Community Health Worker Training Grant in close partnership with Mentua. Her other responsibilities include planning, implementing, evaluating, and disseminating information and recommended policies and practices that support the enhancement of CHW workforce in Minnesota. Previously, Krista worked at Hennepin Healthcare, formerly known as HCMC, for over 12 years, where she led the integration and growth of CHW programs and services within clinics, the emergency room department, hospitals, community and home visiting settings to extend the reach of healthcare into communities and to address social determinants of health. At Hennepin Healthcare, Christian also led several cross-functional organizational programs and incentives, including healthy care homes, behavioral health homes, case management, social services, diabetes prevention program, and community care teams. Welcome, Christian, to the circle. And last but not least, we have Nasader Mohammed. Nasader Mohammed. I have been working as a CHW for 6 to 7 years. Majority of my CHW career work has been with a nonprofit organization called WellShare International. In my new role as the Community Health Worker Training Program Data Coordinator, I will be planning and directing data coordination and program management for the new HPCD Community Health Workers Training Program. Welcome, Nasadir. And then you have myself, Angela Fields. I am the Associate Director of the Minnesota Community Health Worker Alliance, as well as the Manager and Facilitator of the Minnesota CHW Learning Circle. I'm accustomed to working with multidisciplinary care teams across health systems and social systems, providing customized education, information, and applicable resources in a person-led approach for the betterment of those suffering from chronic health issues, including mental health diagnosis, substance use disorders, and others that are experiencing economical disparities. I am a community health worker by trade. I've been a community health worker alongside of Vani. We're actually cohorts together since 2008. I've been connected with the Alliance since almost the beginning of my career in various capacities throughout the organization. And as of today, I am also on the Community Health Worker Scholarship Grant as the Student Support Coordinator. So I will turn this portion over of our meeting to Rachel to start the presentation.
Sorry, hold on a second. Let me get to the beginning of the presentation. Sorry, guys. All right, can you guys see my screen? Awesome. So thank you so much, Angela, for that great introduction. We're here to talk about the Community Health Worker Training Program, which is funded by a HRSA grant. And as you maybe noticed, we've got a team from MDH and a team from the Minnesota Community Health Worker Alliance. So we'll try to help you understand who's doing what on all these amazing teams and all these amazing projects, and kind of who your first point of contact can be for questions. So we did introductions. You met our staff, myself, Angela, and Vani. And we're also just going to talk a little overview of the Community Health Worker Training Program. So we'll talk about the scholarship, field experience, and apprenticeship. And then the Minnesota Department of Health team is going to do their own presentation on the Community Health Worker focused trainings. So again, here's our team. Oops, sorry, Vani. I don't know where your name went. There you go. So as Angela mentioned, the CHW training program is a 3-year program funded by the Health Resources and Services Administration, and it was awarded to the Minnesota Department of Health in September. We are working, the Minnesota Community Health Worker Alliance is working in partnership with the Minnesota Department of Health, the Department of Labor, Minnesota Department of Labor and Industry, and the accredited institutions who offer the CHW certificate to roll out the goals outlined in the Community Health Worker Training Program. The aim of the Community Health Worker Training Program is to strengthen and diversify the CHW workforce, and we're going to do that in multiple ways. So the first way is through scholarship opportunities for the Community Health Worker Certificate. And Angela, like she said, she's the student coordinator for our team, and she'll be the one sort of talking about that. We're also going to be working to strengthen community health worker employment opportunities and increase field placements, internship opportunities for students who are in the certificate program, as well as ongoing employment opportunities. We're also going to be working with the Minnesota Department of Labor and Industry to create registered apprenticeships for community health workers, and then try to promote those as much as possible. And then, like I said, the MDH team will be talking about strengthening the public health workforce, which is going to be MDH developing new and improving existing online trainings to increase the skills and competencies of CHWs, which will include online training that will be free and accessible to CHWs. So Angela, if you want to talk a little bit about the scholarship.
Yes. The scholarship the scholarship program provides 90 scholarships per year for each student. The scholarships are awarded up to $3,750 per student. If in the entire award amount is not needed for the tuition, fees, and books, it can be also used to address the social determinant of health barriers such as transportation, supplies, Wi-Fi. And the scholarship program will create, financial support for CHWs pursuing the community health worker certificate at an accredited institution starting in the fall of 2023. And this funding is intended to support students addressing social determinants of health barriers and provide a wraparound financial support. Next slide. Who can apply for the scholarship? Who can apply? The focus recruitment on will be recruitment on communities most affected by health disparities in Minnesota. HRSA requires citizens or lawful permanent residents with a GED or high school diploma. How to apply? Apply for the CHW program at the school of your choice, at your chosen school, and also apply for the scholarship on the Mentua website. The scholarship will be, our targeted population will be BIPOC communities with limited English proficiency in these communities, as well as those residing in rural communities and under-resourced communities, those that live in or work in the state of Minnesota. Next slide, please. The schools that will be offering the CHW certificate, we have Normandale Community College in Bloomington. We have Minnesota West Community and Technical College in Worthington. We have Northwest Technical College in Bemidji. We have St. Mary's University in the Twin Cities campus. We have St. Kate's University on the St. Paul campus. St. Kate's has their own HRSA grant. And so if you would like to learn more about that, we refer you to visit the St. Kate's website for further details. And I will pass this portion over to Vanya.
Great. I'll just say that our timeline for these scholarships, we're hoping our applications are available now. I just stuck the application from our website in the chat. So students can apply starting about a week and a half ago for those scholarships. We're hoping to start awarding the first round of scholarships in July, and then the first students will begin their certificate program in August. We know that most of the schools offering the certificate program are on a semester schedule, but some are more on a cohort schedule. And so if you are working with a person who wants a CHW certificate that's not on that exact schedule, just have them reach out to us. There's details on our website about how to do that. And I can stick those email addresses in the chat, but this is the basic timeline. All right, Vani, go ahead. Oh, I think you're muted, Vani.
Happens to us all, doesn't it?
It sure does.
So my role as HRSA CHW Training Program Field Experience Internship Coordinator is recruitment and expansion of CHW Field Experience internship sites and apprenticeships. So essentially, I'll be working with potential CHW employers and the CHW certificate schools to continue to expand those employment opportunities for CHWs. And as you heard, I work closely, of course, with both Angela and Rachel, and as a team, we work closely with Menchua Education Committee as well as with MDH, so Kristen and Natsadir, and then also the Minnesota Department of Labor and Industry. And so as CHW certificate holders, if you'll all recall, we completed required internship to gain field experience as part of our CHW training. So I won't talk too much about that. I'll spend this time talking instead about the apprenticeship. Next slide. So any Minnesota organization can become a registered apprenticeship site. The organization will need to complete the registration process, of course, with the Minnesota Department of Labor and Industry. And Menchua, along with MDH, will keep a list of organizations offering those registered apprenticeships, and the list will also be made available for interested CHWs. Next slide. So let's talk about a few of the benefits on both sides of the apprenticeship. For CHWs, the Minnesota Department of Labor has training and wage requirements that benefit the CHW, and CHWs will work as an apprentice within the Learn as You Earn model. CHWs will also have an opportunity to apply for an additional stipend funded by the CHW training program. The benefits for employers are support from Menchua, and then also support from the Minnesota Department of Labor and Industry. And they'll also have increased structure for their workforce development, which also brings a reduction in staff turnover. Apprenticeship eligibility. So CHW certificate holders or CHW students in their last semester of the CHW certificate program are eligible for apprenticeship. And to apply, the CHW or student would apply for the apprenticeship with an organization that is offering the registered apprenticeship program. And once it's posted on the Menchua website, applicants should also apply for the additional stipend. Again, the stipend application is not yet posted, but we'll be in touch with everyone about when that's to happen. So here, we'll talk next about the apprenticeship process steps. First off, an employer determines if in fact their organization will benefit from registered apprenticeship. And if needed, I can assist with talking through the ideas and providing some examples for how CHW apprentice would be a good fit for that organization and in what capacity. If an employer decides to move forward, they would complete the registered apprenticeship process with the Minnesota Department of Labor and Industry, and that's step 2. I'm also able to assist with getting employers connected so they're able to get started on that registered apprenticeship process as well. Once the employer is registered as an apprenticeship, they would hire an apprentice of their choice, and Menchua can also assist with connecting employers and CHWs. And for the last step, the apprentice would apply for additional stipend from the CHW training program. And now I will hand things over to Angela.
Thank you, Vani, and thank you to Rachel and our Menchua team. And so just as a recap, Rachel has included in the chat many of the live links. So there to the application and the informational process. Feel free to also reach out to us if any of those here have further questions. Just as a brief overview on the Menchua team and our responsibilities and roles on the HRSA grant project. Rachel, as the program manager, will work with the team to oversee the team and oversee my role as well as Vanyi role. And she's also responsible for all of the administrative outreach and communications piece, as well as managing the grant process according to the HRSA grant criterias. Vanyi will be in the role as the grant field experience apprenticeship coordinator. And so the purpose of the role is to expand the field experience and apprenticeships and also employer options to open up for graduates of the Minnesota Community Health Worker Training Program. And so this position works alongside of myself and Rachel on the Mentua team. And I am the HRSA Grant Student Service Coordinator. So this role, the purpose of this role is to support the students who are enrolled in the training program. And I will help them at in areas or barriers, socioeconomic areas and barriers they may experience while enrolled in the program, to help them access appropriate resources and connect them with Vanyi for apprenticeship opportunities or any other desires or needs they may have, including getting them signed up for the registry. So now we will turn this portion of the listening session over to our colleagues and MDH team, and Kristen Guthrie Walters will be leading the presentation to provide their roles and functions on the HRSA team in this collaborative training program.
Great. Thank you, Angela and team. Can you hear me okay?
Yes.
All right. I'm just gonna attempt to share my screen here and we'll get started.
All right. Well, thanks for tuning in, everyone, today. And as Angela has mentioned, that we are from the MDH part or portion of this project. And to start off, we are going to be focusing on the trainings and the materials that's going to be developed, created for this particular CHWTP program. And as we have had the previous introductions, Kristen is the CHWTP director for this program, and I myself, Nasir Mohammed, is the data coordinator. So for this grant, it is just basically about the extending and the upskill of the public health workforce by developing new or enhancing existing curriculums to increase the skills and competencies of the new and existing CHWs. And that's just our main focus. Is just basically to kind of create materials and trainings that's gonna further help the current CHWs and the upcoming CHWs in this field.
Okay, thanks, Nasir. I think this is my slide and I'll pass it back up to you.
All right.
Okay, so I think you're seeing the slide. These are the three primary components of the goal for developing new or enhancing existing curriculum for community health workers. So the three main components: MDH will lead the development of topic-specific trainings to advance areas of expertise such as specific health promotion or chronic disease topics, which I'll cover in detail in a few more minutes. The vision for these trainings is that there'll be online modules housed on the MDH My Learning Center website and will include a competency test and a completion certificate. The next component is to build out a training hub on the Community Health Worker Alliance website, or kind of whatever domain is determined, to gather trainings, tools, and resources in one place for easy access. So this focuses more on listing other community health worker specific trainings in Minnesota or nationally that may not be housed or offered through the Minnesota Department of Health or created through this grant, but will be one place to access all of that information. The third component is to enhance existing community health worker curriculum materials by translating education materials into different languages. And Nasdir will talk more about that, but really wanting to make available education materials that are in the CHW certificate curriculum. So I will talk a little bit more about the current progress and content of the MDH training modules, and then Nasdir will be gathering feedback from all of you on other training topics and materials. MDH has a number of federal and state grants that focus on community health worker initiatives to improve health, address social drivers of health, and advance health equity. And through these various funding opportunities, there are sections of MDH in the Health Promotion and Chronic Disease Division that have already started to develop community health worker focused content in partnership with community health workers and the Community Health Worker Alliance and other organizations. And the HRSA Community Health Worker Training Program grant will support the coordination of the development of these training modules, as well as hopefully support the creation of additional modules based on feedback from community health workers like all of you. So on the left side of the screen, you can see the content areas that are planned and or in progress. They include Alzheimer's, cardiovascular health, which includes stroke prevention. That one is already completed. Heart attack, how to talk to your pharmacist, some other topics like that. Oral health, which includes aging and oral health, prenatal, infant, and toddler, children's oral health, parent education for sealant, a number of various topics specific to community health workers. And lastly, there's plans for overdose prevention education modules. The training modules that are already completed or are currently available are on the right side of the screen, and they include supporting arthritis management and the role of community health workers. That was created in past years through SHIP, or the Statewide Health Improvement Program. For asthma, the asthma unit just completed an Association of Asthma Educators training with 14 community health workers from across the state. Some of you may be or may have been in that cohort, and this was utilized to develop an online training module that will be posted in the MDH Learning Center. And then human trafficking prevention is a module that was created and is for all healthcare workers. So it's not specific to community health workers, but it has content that's valuable and appropriate to community health workers. And then stroke care for community health workers. So this module was developed with the stroke section in, and I believe Connie Norman, a community health worker in Minnesota, was involved in helping to develop that training. So you can access current trainings by going to the MDH Learning Center, the link in the presentation, which will be distributed to attendees in the notes. You can log in to enroll in these self-study modules. So they're asynchronous or self-study modules that are available right now, and then the others will be in progress. So now I'm going to hand it off to Nasdir, who will engage in more conversation around trainings and topics for future years of the grant, because we want to ensure that the topics and modules are created are valuable to meet the need of community health workers.
Thanks, Kristen. So being the data coordinator, one of my biggest focus or task is to kind of get the feedback from the current CHWs and to kind of see what the focus is for our future upcoming training sessions and materials that needs to be created for the CHWs for them to utilize. So here's some questions that I've kind of developed and that I would love to get the feedback from the CHWs that are in this meeting today. So as a CHW, the first question being is, what type of health topics should be prioritized as trainings for current CHWs and upcoming CHWs? And please feel free to kind of jump in, say your or give your input. And yeah, so I would just want this to be like a normal kind of discussion conversation among us so that we can get your feedbacks. So going with the first question, any feedback would be very appreciated.
Is it possible to page back a couple of slides to look at the ones in development or already been developed?
This slide right here.
Yeah. I think for me, I think hypertension and diabetes would be great. Mental health, I totally agree too.
I think weight management and or nutrition would be a good topic.
I appreciate that too. I think too, like education that also is culturally adaptive to different like familiar foods.
I don't see diabetes here, but I know lots of us community health workers have been trained in that area already. So question, is there a reason why it's not here? Has it just not been thought up for this particular project? Okay.
Yeah, so that's a good question, Bunny. I think since it has been a lot of work and I could have included it like the diabetes prevention program, there is curriculum available for diabetes prevention. I'm not sure diabetes management specific to community health workers. So yeah, I didn't include that in this list because it's not in this kind of training portal. But certainly could add that to the list.
Thank you for that.
Mhm.
Yeah, and I'm just seeing a few at the chat. We've got mental health, refugee resettlement, and anorexia in the chat for ideas of education topics. Cancer care was just called out in the chat. I think it would also be interesting to have conversations around or a training around talking about addiction, not just like substance use disorder types addictions, but like how to create good boundaries with screen time and how to talk about being physically active and balancing that with screen time or other kind of these sort of lower grade addictive things that we all engage in.
Any more feedback on that first question? Or is everybody ready to move on to the second? All right. The second question being, what type of health concerns / questions are being asked from the communities that you are currently serving? Which kind of somewhat will give us a direction of, for the first question, like it will kind of maybe give us like an ideas of like what needs to be actually focused by from the concerns or that we are getting from the community. So yeah, go for it. Anyone? Okay.
Well, I feel like as a doula, the clients that I work with, they do have access to midwifery as well as their other prenatal nurses and providers at the clinic level. But a community health worker would definitely, from what I'm seeing and interacting with my clients as a doula, they also just are really, hungry for the prenatal experience and extra resources and topics around perinatal care. And that's even outside of my meetings as well as outside of their routine appointments.
Okay.
I just participated in a a study on community-driven healthcare. And I think one thing I heard a lot was more, oh my God, I just had the word, holistic approaches, not so much medicine, and they just feel like they really are sick of doctors always trying to push medicine, and they would like more holistic approaches and like working with more holistic practitioners. So that could be one thing. A health concern is that they don't want to take medication so much that they would like some, natural products. Thanks, Alicia.
And I just think that balance between when you should be sort of encouraging patient activation and patient engagement and healthy behaviors and natural things, and when it's most appropriate to use like Western medicine. I always find myself sort of torn between those two things, and I find that in our system it's often two different extremes, sort of the holistic, all natural practitioners versus the standard practitioners, and how does a patient know when it's most appropriate to use one or both of those? I don't know if that can be done into a module, but that's something that I've been thinking about a lot recently.
There's lots and lots of trauma, especially in the African American and BIPOC communities and communities of color. So something addressing trauma-informed care, resiliency, well-being in those aspects from those, from those type of lens.
Yeah, it would be awesome if every single module had a specific call out to like how to do this in how to do this specific teaching in a trauma informed way. So so having a whole trauma informed care module, but then also just integrating that into every single module so that it's just repeated over and over again, and people really get in the habit of thinking that way.
Absolutely. So it's trauma responsive. Yes. Another thing that popped into my mind is terminology. I've been hearing that from interns, as especially those that this is their first healthcare career, struggle with on the job and medical and health terminology, even system terminology and acronyms. That's the feedback that I've been getting from students.
All right. And then our third question is, which format will be most useful for the focus trainings, such as modules, PowerPoint slides with audios, and etc. Yeah.
I agree. Yeah, those all could be good avenues.
I think the primary capability of the MDH Learning Center, where a lot of the modules are currently being developed and implemented, it's, a recorded self-study module that has essentially, like PowerPoint slides and audio, maybe some interactive components, kind of a short quiz for competency at the end of the module, and then a completion certificate. So it's, something you take on your own. It's kind of audio and visual. And so that's what the MDH Learning Center is and what will be used. Does that feel like it is a format that is helpful? I know there's other ways and type, to do trainings. That is kind of the specific content that's on the Learning Center. Does anyone have any thoughts on that specific format versus, in person or synchronous live trainings?
I think those suggestions sounded good to me. With schedules sometimes can get pretty hectic, and breaking away, finding the time to break away from your daily work days can be kind of a struggle for some of us as far as time management. So having that a bit those options, sounds a good avenue to go down.
So the pre-recorded PowerPoint slides, it's just that self-study seems a very good route to go, you saying, Angela?
It could be. I mean, it may vary across the board based on from CHW's preferences or availabilities.
Okay.
I wonder if kind of almost test driving some of the content live, so you get kind of an like a live option where you can get interactivity and more questions about like what specifics within the topic, and it can kind of help improve what the final product might be. Might help.
Yeah, that's some good insight.
Any more for that last question?
Not for me, it's good.
Okay. All right, let's move on to the next slide, Kristen. Thank you. So this slide pertains to the materials. And with this one, also kind of the same formatting with the previous one. So as a CHW, what type of topics or content areas for educational materials from the CHW curriculum would be most beneficial to be translated into other languages that reflects with the day-to-day work of a CHW?
We get all.
Mhm.
This is Alicia Brambilla speaking. I'm not sure who we're talking about the CHW curriculum when I went to Normandale. Is that the same? And when I went to Normandale, we touched base. It was so fast on so many topics. And, some of the feedback I gave was, I wish we would have dedicated more time on each topic, because each topic is so important. And depending on what field you are and what type of client and community you're working, I mean, all of them are very important. So that's why I say I think it's very important for all. And if we're talking about what I think, it's the CHW curriculum.
Okay, so just that more extended time with each topic individually as versus as just going through it quickly.
Yes,
You would prefer. Okay.
definitely. Yes.
Sounds good.
Yeah. And I think the idea of this is to take some of the materials that are a part of the curriculum, which it sounds like maybe, goes kind of quickly because there's a lot of health topics covered, but to take those like educational handouts or materials that you would usually give to, patients or clients or individuals, and to make those available to community health workers, and then to also translate some of those materials into other languages or formats so that community health workers that complete the curriculum training, get their certificate from the program can then, utilize those materials with patients and community members in the future.
Any more suggestions, inputs on the first question? And yes, I'm seeing all the extra comments and inputs on the chat, so I am not overlooking those ones. I'm getting them.
We have diabetes for sure.
Yep.
We have, I think they all sound good. Those are some good ideas.
All right.
And that's all the comments that were in the chat.
All right, next question is, what format of the educational materials are most helpful to CHWs in working with clients or patients or just the overall community members? Once again, would it be useful to have it like in a pamphlet or brochures or videos and etc.? Or once again, all of them? Or is there one that is favored over the other?
I feel like it depends on, number one, the individual that you're working with. As perhaps some people are not going to be able to read the brochure because of maybe the font size, or maybe people have vision impairment issues, but then some people are really good with videos. I also think for setting, if you're in person, videos are really good. So whether you're in a clinic or in a home setting, videos are great. A great tool for people to be able to just watch it in real time and then discuss it as well, as opposed to reading through a brochure and that taking a little longer. So I think all of the above.
I agree with Vanyi, and considering also the client or patient's cognitive abilities. So you're just kind of meeting them where they are. Let's see, I saw something in the chat. Someone, Alicia said, like all, I said, it depends on the client's learning, and then Latrice said, I agree. Just case by case, but those are all good options.
So from the sounds of it, just basically having those materials created in those different options, whether it's the brochures, videos, just having those options available, and then just depending on the clientele, they could choose from that.
Yes.
Sounds good. And lastly, what languages should be prioritized when translating the CHW curriculum materials? Once again, to those examples, yeah, what languages should be prioritized when it comes to creating materials?
We got they're popping off like a firecracker. Okay, well, they're coming in. Wait. We have Spanish, Somali, Vietnamese, Spanish, Hmong, Amoro, and Karen. Cambodian. Kamar.
I'm not sure how you pronounce it, but I know that it's the same, I believe.
Pronounce that, Latrice.
I don't know. Is that how you spell Nepali?
Well, Nepali.
Thank you, Vanya.
Nepali. Thank you, Vanya.
Very welcome, you too.
I don't know. I think it's also important to just add that, which I know you guys will take this into consideration, but just to make it really plain and simple to understand, not, big words or words that people are going to have to look up to know what, it's saying, the curriculum is saying. Right. It's right. I know. I was gonna say plain and simple, dumb it down. That's what like I said, I
Is
just
it-
did this community engagement study, and that is one thing that most of the community said was you gotta dumb it down. Cause yeah.
I agree, Latrice, that's really important, especially being community health workers and we're delivering that information to the community. We have to deliver it as well in a simplified way too.
Yes, the simplest, the better.
Mm-hmm.
I found it very helpful when there were definitions for words that were not common in our language.
Yes, definitely so.
I ran across a tool called SMOG. It stands for simple measure of gobbledygook. And it's just kind of a health literacy tool. And it could be something helpful for CHWs if they're trying to kind of synthesize materials together or just checking their own kind of communication for like literacy levels, health literacy levels. So if that's of interest, I don't know.
Yeah, Kelly, do you have a link to that? Can you throw that in the chat so folks can check it out?
Yeah, I'll see what I can find.
Thanks.
Thank you for sharing that, Kelly. All right. And yeah, I mean, thank you guys for your inputs. I feel like one question that I just want to throw out there that may not be on here is, so in regards of creating these trainings and materials, especially the training part, do you guys think that it would be feasible to, I guess, have a CHW themselves be a part of creating these trainings, I guess, like just to have a CHW on board to create these trainings along with us, I guess. What do you guys are, what are you guys' inputs on that?
Yes, absolutely. Nothing about us without us is
Mhm.
our leading principle, and we would like to keep it that way. So we would like those incentives, initiatives, material and content to involve a CHW voice in some type of way to ensure that we have the closed loop on that, nothing about us without us.
Absolutely, I agree with Angela. And then going back to what I said too about making sure that the content is simplified for all CHW so that we're also able to deliver that information to the communities that we serve.
All right. Is there more to the presentation, Nessa?
Nope, that's just pretty much it. That was the last question that I wanted to ask. But yes, thank you guys for your inputs. This really means a lot. I mean, it will definitely give us something to think about and to go forward with. So thank you for your participation. Appreciate it.
Yes.
Thank
Thank
you
you.
all.
Thank you both teams, and thank you all for joining us today at the June 7th Learning Circle. and learning more about the HRSA grant and the goals of the scholarship program. And the intentions is to strengthen and diversify the public health workforce in Minnesota to better address the needs of those in underserved communities. And as a reminder, the scholarship was awarded to pay for CHW certificate programs by way of a scholarship through a partnership through Minnesota Department of Health, MDH, and the Community Health Worker Alliance, Mentua. We have Rachel, our program manager, has added in the chat various links to our website to learn more information about the scholarship process. And you feel free to reach out to myself, Rachel, or Van Yee if you have questions about the scholarship process, the student support process, or the apprenticeship process of the grant. As well as if you would like to learn more about what or be involved with MDH's process and their contributing to the program, please reach out to Kristen Godfrey Walters or Nessa Dare regarding her data coordination or any further follow-up information. Thank you for joining us, and we will give you 24 minutes back to your day as we close out. Is there any comments or suggestions or feedback you would like to pursue in a conversation after this session is over? Feel free to stay behind. Other than that, go out and grab some sun. Bye.
Angela, I'm gonna stay. Can Vanya stay?